Now we'll discuss about the ceftriaxone, that is from the cephalosporins. We'll discuss therapeutic uses, mechanism of action, adverse drug reactions, contraindications, and everything. See, classification I had told in the previous lecture, you can check it out. So, coming to the mechanism of action of ceftriaxone, PBP, it is penicillin binding protein. The ceftriaxone enters the bacterial cell and binds with the penicillin binding protein and prevents the cross linkage formation. Okay, it prevents the cross linkage formation. So how it happens? In the bacterial cell wall there is a sequence known as, this marker is there is a sequence called D-alanine. Okay, this D-alanine sequence, when it is being cleaved by transpeptidase, when this D-alanine sequence in the bacterial cell wall, when it is cleaved by the transpeptidase, what happened? There will be cross linkage formation. So this D-alanine sequence is mimicked by our ceftriaxone drug. Okay, ceftriaxone. Our ceftriaxone drug, which is a cephalosporin, it mimics the D-alanine sequence and it inhibits the transpeptidation. Okay, so there will be no cross linkage formation, though so eventually the autolysins will be activated and osmotic pressure inside will be increased and the cell will be burst. So this is a mechanism of action of ceftriaxone. Okay, it is similar to that of penicillins. You can check the previous video where I had told very clearly. And coming to the therapeutic uses, see, we are discussing about ceftriaxone, right? Ceftriaxone. Take till ceftri. C-E-F-T-R. Ceft. First one is community is acquired pneumonia, then enteric fever, that is typhoid fever. Also for, we can use it for what, multi-resistant variants. Also, and fluid infections like UTIs, septicemia, and abdominal sepsis. Okay, and we can use it in treponema pallidum. What does treponema pallidum cause? It causes syphilis, right? So in the primary syphilis, we can give 1 gram IM for 7 days. But if it is latent syphilis, we have to give it for 15 days. Okay, and reproductive infections like gonorrhea, we can give it. And you can also take I, that is inflamed meninges, we can use it. Okay, so what happened here, we had written the drug name ceftriaxone, and from the drug name itself we are taking all the information what we want to write in the exam. So this would be more we can say more interesting way to read, and we can easily remember it. Okay, these are the therapeutic uses. And next we'll discuss about the adverse drug reactions. See what happened in this Cephalosporins Ceftriaxone. It will inhibit, or what happened here, there will be hypoprothrombinemia will be there. So there will be increased bleeding risk. Bleeding risk is increased, so we can take the mnemonic bleeding, BLEEDING, right? So from that you take bled. So L for low prothrombin, that is hypoprothrombemia, and B for bleeding risk increased, E for excessive RBC destruction, and E for is right, dose dependent irritation. At the site of injection we'll have dose dependent irritation also we can have. Yeah. And ADAs, right? So contraindications. In contraindications we can write allergic reactions. The patient who is previously allergic to it, we should not give. And one more important thing is, see what happens, this ceftriaxone will displace the bilirubin from its protein binding site. So if you give this ceftriaxone, what happened in neonates, it might cause kernicterus. Why? Because this ceftriaxone binds with the protein binding site, and it will displace the bilirubin. This is bilirubin. Okay, this bilirubin will go and accumulate in the CNS and cause kernicterus in neonates. Okay, so it should be a contraindication in neonates. What is it? Ceftriaxone. Okay, why? Because it is displacing the bilirubin from protein binding site, it is causing kernicterus, so we should not. Yeah. Now we'll discuss about the drug interactions. First thing, if you combine the ceftriaxone with sulbactam or tazobactam, what happen? These drugs inhibit beta lactamase. See, this beta lactamase produced by the bacteria which secrete the beta lactam ring, and the drug will be important. So this sulbactam or tazobactam will inhibit this beta lactamase, so that our drug is protected, that is ceftriaxone, and it can take out its action. And antimicrobial resistance, to overcome antimicrobial resistance, we can use this sulbactam or tazobactam. It gives a positive effect. Okay, it gives a positive effect, we can use them. If you combine with calcium containing agents like Ringer's lactate, what happened? Insoluble crystals are formed. They will deposit in lungs and also kidneys, mainly more toxic in neonates. Okay, and if you combine with bacteriostatic drugs, see, these are bactericidal, and they will act majorly on the rapidly multiplying bacteria. But if you combine them with bacteriostatic drugs, they may not be that effective. So these are the most important things: drug interactions, adverse effects of ceftriaxone from cephalosporins. Thank you.